delay, I would like to begin today's event, once again sponsored by Dell and hosted by Health Data Management. And now I'd like to turn it over to your moderator, Keith Tyson, Healthcare Security Consultant. Keith, you have the floor.
Thank you. Just by way of introduction, I'll be the moderator for today's webcast. I'm a healthcare industry consultant with Dell Healthcare and Life Sciences. And in that role, I manage Dell's healthcare security strategy, messaging, and thought leadership. And I'd like to introduce our panelists today. First, we have Doug Copley. Doug is a senior security, risk, privacy, and IT leader with a history of success establishing and managing enterprise information technology, security, and privacy programs in large, complex, and highly regulated environments. He's active in statewide and national healthcare, cybersecurity, and critical information protection initiatives, and frequently speaks at industry events. He's also experienced in strategy, policy, compliance, risk management, metrics development, operations, consulting, support, and delivery in both in-source and outsource environments. He also has a broad-based knowledge in security, privacy, and IT-related laws and regulation and industry frameworks. I'd also like to introduce Martin Edwards. Martin is is Dell Healthcare and Life Sciences Chief Compliance Officer, where he is responsible for the HIPAA compliance activities, including privacy and security. And prior to joining Dell, Mr. Edwards held the position of Corporate Compliance Specialist at Baylor Healthcare System in Dallas, Texas. He has over 16 years of healthcare operations, management, and compliance experience, and has provided leadership to hospital-based ambulatory clinics and hospital-based physician practices. He served as a Compliance and Privacy Officer and Operations Director in positions for public, private, for-profit, and nonprofit healthcare systems, and he received his Bachelor of Science degree in Biology from Clark College in Atlanta, and his Master of Science degree in Healthcare Administration from Texas Women's University. And he's also certified in Healthcare Compliance, CHC, and Healthcare Privacy Compliance as a CHPC. And I'd like to introduce Jessica Morrison. Jessica is a Senior Product Advisor and Subject Matter Software, where she's responsible for marketing Windows management, IT governance, risk, and compliance solutions, and provides assistance to customers and strategic partners around the world. Jessica has more than 10 years of international experience driving IT and marketing strategies for organizations and helps customers with technology solutions. And before joining Dell, Jessica worked for IT consulting firms in the U.S. and the U.K. specializing in Microsoft implementations. So just to kick off our topics today, our goal is threefold. We would like to discuss with our panelists first the healthcare information security landscape. As we know, a lot has changed, and that there's a lot going on, and every day we see more and more breaches in the news, and healthcare has, for better or for worse, taken that spotlight. And we'll discuss some of those trends and what they mean for the future of the industry. Secondly, we'd like to discuss regulations, compliance, and business associates as it pertains to HIPAA and regulations and what that means for providers. And thirdly, we'd like to discuss mobility, security programs, and best practices. As we know, the industry is changing with the Internet of Things, BYOD, different programs, and creating a lot of confusion as well as opportunity. And we'll discuss some of that as well, and then move into Q&A. So to start with, we'd like to kick it off with the healthcare information security landscape. And within that, we'll move to our panelists. So the first question here is that, as we know, breaches have increased at an alarming rate, and a lot of indicators show that breaches have increased up to 600% even in the past year. And what factors do you think contribute to this trend, and how should providers shift their focus to meet these new demands?
So Keith, this is Doug. I can go ahead and start off with this one. The thing healthcare companies need to realize is this is, a new era, right? From a security standpoint, HIPAA requirements have been around a long time. But there's certainly a lot higher expectations today from both regulators as well as governments to make sure that we really are adhering to our responsibilities as well as our responsibilities to our boards. So in terms of, breaches increasing at an alarming rate, I would question whether that's actually true. You know, I think that those of us working in healthcare and those of us who have worked in more mature industries from a security perspective understand that, you know, the healthcare industry is behind in terms of its adoption and implementation of some of the more state-of-the-art security practices. And, you know, I think what we're seeing is not necessarily an increase in the number of breaches, but an increased awareness of the breaches that are actually occurring. You know, I can certainly say within our own organization, you know, our competency in terms of our protections and our activities, our defenses, you know, have certainly grown. And although when we produce metrics, it shows that our, you know, our threats and our activities are going up, it's not necessarily true that they're going up, but our capability to detect and respond to those events has certainly increased. And being in the healthcare industry, and in particular being a healthcare provider, you know, there traditionally hasn't been the investment, certainly in nonprofits, right, to invest in the security technologies that are required in today's day and age, you know, to provide adequate protection. The focus is on patient care, right, which is a great focus for a healthcare provider, but there also needs to be investment in some of these protections to protect not only our own data, but our patients' data and its privacy.
No, this is Marty Edwards, and I'll agree with Doug that the landscape has changed, and I'll agree that there has not been necessarily an increase. I think we've become more aware of it. Our customer and our patient expectations on how we protect information and their information has led largely to the efforts that we put forth. As I said, HIP has been in place since 2005, and healthcare organizations are now deploying the necessary risk assessments and assessing their environments to determine where their information sits, where it lies, how it's being utilized, and how are we protecting that information. It's an expectation that we as consumers actually have, and we expect that from our healthcare providers. As Doug indicated earlier, the healthcare environment is behind from where some of the other industries have been in the past, and we're now catching up with some of our technical pursuits, as well as some of our regulatory requirements that have come into place, as it's caused us to focus more upon how this information is protected and how it's secured. So with that in mind, we have to make sure that we keep abreast of the change in technology, the uses of this information, particular mobility, you know, BYOD programs. Everybody wants the information right now, not yesterday, so that on-demand expectation we have for information puts a lot more expectations on healthcare providers to protect that information. So I would agree that there's probably not been a significant number increase in breaches. We're just becoming more aware of them. We're now looking for activities. We're looking for those vulnerabilities within our systems, within our processes. And it's not just electronic processes that we're looking at. We also have to keep in mind the manual aspect of protecting the information, how it's used, how it's disclosed, because that also ties back into the privacy rule as well.
Okay. Any other comments on that?
Yeah, this is Jessica. I would just say that, you know, following up a couple years ago in the Office of Civil Rights, when they conducted audits, I believe it was somewhere around 2/3 of audited entities weren't able to, you know, perform a complete or accurate risk assessment. So sometimes it's just, you know, going back to the basics, but that, of course, can be difficult to know exactly, you know, what data needs to be regulated and where that resides.
And the only other thing I would add, this is Doug again, is, you know, in today's day and age, you know, if healthcare entities read the media, you know, and read up on the articles about Chinese hackers attacking companies and think that their organization is exempt from that, they're kidding themselves. You know, I just recently had a conversation yesterday with my security operations staff, and they show me the attacks that they see coming from China. So even though I look at it and say, I can't imagine any hackers from China would have any use of information at my organization, they're absolutely knocking at our doorstep.
Yeah, I agree, and that's why we have all the necessary, you know, network monitoring activities and the other intrusion detection processes that we have in place to help identify that, because it's not a matter of if you're going to get hacked or if you're going to have your information compromised in the healthcare provider. It's a matter of just when is it going to occur and how big of an impact is that going to be to you. And from a healthcare perspective, one of the things that we look at things from a financial perspective, because, you know, healthcare is such a heavily financing, you know, service line. You have to also take a look at the reputational harm that comes with these breaches. And therefore, you want to maintain that reputation that you have with your customers. And breaches that, some of the recent breaches that we've seen in the press over the last several months, over the last several years for that matter, leads us all to understand that our reputations from a healthcare perspective must be maintained. And how are we going to do that if we can't make sure that our customers feel that their information is safe, is secured, and we're using it in accordance with what we're obligated to do?
Thank you. And that leads me to the next question, which is, you know, we've all heard about these major breaches that have had devastating economic impacts, as well as just the sheer number of people that have been impacted by the Target and Home Depot breaches, and recently the Sony breach as well. Do these recent breaches mean anything to you in the healthcare industry? And, you know, has it changed the public awareness of how much an impact breaches can have, and can we learn lessons from these breaches?
Well, this is Marty. Yeah, I mean, absolutely we can learn lessons. I mean, just like any other thing, you know, we learn from the mistakes of others or the errors that have occurred. Just to give you an example, Neiman Marcus, they hired their first chief information security officer that Neiman Marcus has ever had in its entire existence. And what prompted that? That was prompted by the recent security incidents involving Neiman Marcus, as well as some of the other attention that has been given to Home Depot and Target. So we actually learn from those experiences, and even from a healthcare perspective, we need to take a look at that and make sure that we implement the necessary monitoring tools, education and awareness, training for our employees, making sure they understand what their obligations are to protect information, and how to minimize security events from occurring. Just an example, as of today, that was actually a phishing email that came across our Dell network today. And I've been notified by at least 30 individuals today about an email that came through. Fortunately, they didn't open it. And why is that? It's because we've provided them the necessary education. We've learned from what has happened in other environments and other institutions. So this is how we've actually been able to, you know, teach the individuals what their roles and responsibilities are to help protect the information that they have access to and the information that we possess.
You know, Marty, it's interesting that you say that. Again, this is Jessica, and obviously I work for Dell as well, and that goes on to, yeah, you know, you need to make sure that all of your employees are trained, and it's not just those that are personally dealing with PHI, but everyone. So, for example, you know, here at Dell, you know, we have to go through an annual compliance training, and if we don't, then we have repercussions for that. Yeah.
Yep. We do.
So this is Doug. So let me add some perspective. I think I will echo what Marty said and Jessica about education. You know, I am very passionate about security education and feel very strongly that we can't educate enough, right? Because that's typically going to be your weak link, is that user who's not educated enough, who's going to click on an email that's going to get malware in your environment. Probably the most common vector out there today that's cyber criminals are using. But back to the, you know, learning from other industries. I love to discuss the Target breach because there's so many missteps, right? Or so many things they did wrong that are such good examples, right? Whether it has to deal with protecting their payment systems, whether it has to do with user education, whether it has to do with vendor security risk assessment, just lots of different things, right, that they could have done a lot better. But I think, you know, we're specifically talking about healthcare here, and I think the misnomer is that things like PCI compliance don't apply to healthcare. And I will tell you that's absolutely a misnomer, because you can walk into our hospitals and we accept credit cards, you know, at the cashier's office, in the gift shops, at the Starbucks in the lobby. We allow patients to make payments online, right? So we are every bit as vulnerable, you know, to a credit card breach as Target or Home Depot, you know, these big retail entities that have made it in the news.
Yeah, absolutely. And just a comment on what Doug has indicated about education. The majority of breaches that have occurred have been due to human involvement. They're not necessarily due to hackers and things. You can hear about the large breaches, but if you take a look at the number of events, and if you take a look at the events that are on the Office of Civil Rights Wall of Shame, many of them are due to human errors. Loss of a laptop, leaving a laptop in a car, an unencrypted laptop in the backseat of the car, cars broken into. Information is then, therefore, you know, ascertained by an unauthorized individual, therefore it's a breach. So that's just one example of lessons that we still need to communicate to our employees and to all of our staff, even to our friends and family. You know, sometimes this stuff extends beyond just what we do internally. We as consumers in the healthcare environment, we're also customers of the services that our patients receive. So we're subject to the same security concerns as well. I personally have been breached on more times than I'd like to count for lost laptops from various organizations. So these are lessons that I try to utilize when I'm back out educating and training my employees. Use these as real life scenarios because they're able to relate to it. It's not something that doesn't happen to them every day, but they hear about it enough so they understand what steps they need to take.
The other, just one more thing, the OCR also lists, you know, those same organizations that they do call out, but the OCR does that to also give them as a reference for case studies for other healthcare organizations. So I already see a question in the chat panel about, you know, guidelines for do's and don'ts, and you can go to the OCR website and you can readily see those case studies as well as resolutions and what those healthcare entities had to do to be compliant again.
Thank you. And just very quickly, what keeps you up at night? Just one quick comment from each of you. What's your biggest concern?
What I don't know. It's the unknown. It's the unknown. The things that we know about and the security, vulnerabilities, and activities that we know about, we can typically plan for those things and we can respond to those and mitigate harm, put in remediation efforts. But it's those activities that you aren't aware of, some of the uses of the information that keep me up at night.
Yeah, and I actually echo Marty. You know, I mean, I was going to say, you know, will we detect the breach when it happens? But it really gets to the same thing Marty said of, you know, not knowing what we don't know. And so, you know, we've talked about healthcare companies being behind and us building up our defenses. And one of the reasons I believe that healthcare records are more valuable on the black market is our inability to detect the breaches in a timely manner. So the question is, when we have that breach, and I'm convinced that we will, right, how soon am I going to be able to detect that? Or is it going to be going on for months before we figure out what's going on?
Okay, thank you. Jessica, any quick comments?
Nope, I agree. It was spot on.
Okay. All right, well, let's move into our next topic, which is regulations, compliance, and business associates. So our first item here is, could you discuss what's happening with new regulations like the HIPAA omnibus that was released, and how can providers best manage security risks with business associates and other vendors in the face of that?
Well, as of recently, when the HIPAA omnibus rule went final, the biggest impact of that is that it held business associates liable for any security incident, but most importantly, it held us accountable. It said that we had to comply with the HIPAA security rule, and that any breaches and harm and liability that's associated with an incident, a business associate could be held directly liable for it. These are the expectations that covered entities now expect for a business associate to take into account when they're structuring their security program. They expect for business associates to conduct risk assessments based on the services they provide, particularly any data that they're hosting, whether or not it's just a data hosting environment or if you're providing business processing services for a covered entity. All of those facets are things that are now covered as part of the HIPAA security rule, and I think it's made us as business associates, and I'm speaking from a Dell perspective because Dell does operate as a business associate, we've now structured and have always done so, made sure that we conduct our risk assessments, understand where our information is, how it's processed, and what our responsibilities are to our customers, and how we make them feel comfortable that the information that they provide to us and the services that we provide to them will be stored securely and used in accordance with what's allowed by law, as well as contractual obligations that we have with them. Those would be the, in a nutshell, those would be the biggest aspects from a business associate standpoint.
Okay, thank you.
So I can chime in for a second here. I think part of this goes back to the organization's responsibility for just, comprehensive security risk assessments in general. But I think back of, what we did at the financial services company I came from, and this is kind of vendor management 101, right? The way I look at it is, we have business associates, and if we're going to transmit patient data to them, particularly identifiable patient data, we absolutely should be looking at their security practices and talking to them about making sure that they are adequately safeguarding that information. So the omnibus rule, when it was revised, certainly came in with a stronger perspective and held business associates directly accountable. But these are really practices that we should have been doing, even without them being held personally accountable like that. It's good business practice, good risk management.
Right.
Yeah.
We're now, even from a Dell perspective, as a business associate, many of our customers, as part of their RFP processes, they provide us with a due diligence checklist so that they have some sense of what type of security practices, safeguards, and controls that we actually have in place. It's not just signing a business associate agreement, but they want to have more assurance that we have the controls in place, we have the appropriate processes, incident response plans, education and training for our employees. And as a subcontractor, subcontractors to a business associate, we need to do the same type of due diligence for those individuals that we bring on board, because we're providing them access, or they are providing a service, to our customers, therefore exposing them to EPHI and other sensitive data. Sometimes it's not just all health data. Some of it is PCI-related information. It may be other data as well.
And I would just stress to make sure that you have a written agreement with your business associate. Unfortunately, we've seen that happen a few times where there was no written agreement, and that's a requirement with HIPAA.
Yeah, and the federal government has also indicated that even if there is not a business associate agreement in place, if an incident occurs and you are performing business associate related services to a covered entity, then the federal government clearly has the authority to designate you as that, and as a business associate hold you accountable whether or not you have an agreement in place or not.
Okay, yeah, we touched on this briefly, but do you have any quick comments on how these new changes have affected the way providers respond to protecting patient privacy that we haven't addressed already?
I'm not sure it's necessarily any particular focus area, but it's just, the increased due diligence. So we understand the stakes are higher, and we're forcing more of that due diligence into the healthcare industry, and some of that's painful, but it's just requiring us to put more effort into that, the risk assessments, the risk management, and just protecting that information in general.
Okay, thanks. And what about audits in that regard? So we know that the Office of Civil Rights has indicated the intent to continue that audit program in 2015. What should healthcare organizations expect from that initiative, and how can they best prepare in the case that they are audited?
So I can tell you that auditors will be looking for a practical application of privacy and security policies through the entire organization, and it really falls into three categories, which is all around information risk, security risks, and privacy risks. So to give some, examples, they'll be looking at encryption, they'll be looking at BYOD, cloud storage, they'll be looking at malware. For security risks, they'll be looking at mobile devices, for example, as well as employees and possible breaches that could happen from the inside, just some things.
Yep, I'll echo what Jessica said. The information, I haven't had some discussion with individuals from OCR, the things that they actually will be looking at, and they'll be requesting as part of evidencing from their audits, are evidencing of your security risk assessments, any risk analysis, and also that you actually have a breach incident response policy in place, and if it has been tested, and if it has, what's in the outcome, or were there any remediations that were necessary. So they want to see some evidencing of the effectiveness of your overall program. And I think the security risk assessment probably bears more weight than anything, because it's very difficult for you to implement security controls if you've not assessed your environment to determine where your risks lie, where your vulnerabilities are. And that'll help you address things such as Jessica mentioned from a BYOD standpoint, understanding what kind of protocols you have in place, patch management, intrusion detection. Those are all things that you should be addressing within your risk assessments anyway.
Mm-hmm. And I think that the OCR, they want to move away from like a checkbox approach and more to that risk assessment approach. So the one thing I always talk about when speaking with customers is that you could have the most secure system in the world, but if your employees aren't trained, if they're not knowledgeable, it will make those systems insecure in seconds. So it goes back to making sure that you have a good security awareness program in place.
And thanks, and that really actually touches on our fourth item here, which is, what are the areas that healthcare organizations, when they're prioritizing these initiatives, what should they be most concerned about? Should they focus on PCI, the audit plans, or HIPAA, or is there really a broader approach that they should consider, like you alluded to that, Jessica?
I mean, I really look at this as for the most part, basic blocking and tackling from a security program perspective. Yes, absolutely PCI for the comments that I mentioned earlier. But it's really looking at that from a comprehensive program perspective. And, I'll echo what Marty and Jessica said about the criticality of that risk assessment, because that really is intended to drive your activities from a security program perspective. The other thing, I'll mention a couple articles that I've recently read. One specifically talked about audits and not the OCR, but what the Office of the Inspector General intends on looking at from a HIPAA compliance perspective, which is typically not something that you would hear a security team talk about, but it's the EHR contingency planning. To make sure that, because we are so dependent on these EHRs today, making sure that we have appropriate business continuity plans in place, should something occur with that system and it's not available. The other thing I will call out, too, from an audit perspective is system patching, which was also mentioned a few minutes ago, right? That's a basic blocking and tackling for a security program. And last week, the OCR set a precedent and fined an entity in Anchorage, Alaska, $150,000 because they had a breach and they tracked it back to vulnerabilities in their systems that they did not patch. So they called them out for failing to identify and address basic risks. So, we've got to be doing that blocking and tackling.
Thanks. And before we move off this topic, we did have a couple of questions that were pertinent to this that we might as well address while we're in this. But one question we got was, are there clear guidelines within the healthcare industry on do's and don'ts to help achieve at least 95% compliance in the case of a security breach?
Mm-hmm. If you go to the OCR, they actually do a fantastic job at laying out by security, privacy, and data breach protocol what is recommended as well as what is addressable. And again, you can also take a look at specific case studies on what other entities had to do.
And a lot of the do's and don'ts are also going to relate to, like echoing what Jessica said, but a lot of the do's and don'ts are going to relate to common security, privacy and security practices. And you can facilitate that through your education, your training, and understanding what the rules are in privacy and security, and how you implement those in a practical manner so that the employees can actually utilize the tools and the processes you have in place. One of the things that makes it most difficult is to have a policy or a procedure that operationally doesn't work. It sets up for failure. But getting back to the do's and don'ts piece of it, I think a lot of it has to do with basic data security practices. You know, don't leave your laptop, unattended in the car. Don't allow sensitive information to be stored on unencrypted mobile devices such as flash drives or other USB devices. Have protocols in place that govern the use of BYOD devices. Those types of activities.
Yep, same thing goes for access and authentication and all that.
It's actually a great segue. So back on the introductory page, right, it mentions two titles for me, and one of my titles is the chair of the Michigan Healthcare Cybersecurity Council. And that's a council that was started in the state of Michigan a year and a half ago, and the sole purpose of that council was to bring myself and peers of mine together across the state to help improve the state of cybersecurity preparedness in the healthcare industry. And so there's a link, I think, on the back page of this presentation to the council website. But we got together and we formed subcommittees and we work on some of these areas, and the whole idea is any work product that we develop as part of these subgroups, we will put out for public consumption across the healthcare industry. And those current subgroups that we're working on are mobile device security, or not mobile device, excuse me, medical device security, security frameworks, incident management, vendor risk management, and security training.
Thank you. And actually, with touching on mobility, mentioning that does segue into our next topic, which is mobility security programs and best practices. So within this, we know that there's always a fine balance of securing data in motion and data at rest without creating additional processes and slowing down workflows. In your mind, how can healthcare organizations securely manage access to that patient information without slowing down those clinical workflows?
So I'll go ahead and start off here. It's back to what you traditionally look at from a security perspective as a layered approach to it. There's multiple points at which you can apply security. I will start out by saying mobile devices, whether it's cell phones, iPads, in the healthcare field are absolutely critical. Doctors are walking in, with their iPads, seeing patients at the bedside, documenting on patients on their mobile devices. It's just an absolute necessity from a business process standpoint. But in terms of the layered security, some of the things we do to help protect against that is leverage virtualization. So whether that's, a virtual desktop or a virtual, instances of applications, whether it's, applying simple things, such as mobile device management, very, very pervasive these days, right? But it's about protecting the information that's on the device. Obviously, through virtualization, we're trying not to put the data on the device at all. But should the data be on the device, it's all about encrypting that and being able to remove that if the device is lost or stolen, or if somebody, is being malicious and leaves the organization, you need the ability to erase the data off of that device.
Yeah. I was in a conference last week, and one of the discussions that came up was about data security regarding text messaging between nurses and physicians. And we all know that text messaging and between physicians and nurses take place. We understand the ease of it. It's expeditious in, getting orders across and communicating with individuals. But if you are communicating EPHI in there, you're subject to security of that information. So we know that there are now currently text messaging solutions that can facilitate, secure data transmissions. We need to make sure that those type of activities are in place because otherwise you run the risk of a security incident that occurs, because you didn't have the necessary security protocols in place. And that was a very detailed discussion that we had, and it's something that I've been a part of in several committees here in the Dallas area related to mobile text messaging and the best way to communicate the solutions that are available and identifying what solutions are best for each organization. A small two-doctor office practice probably is not going to need the same level of data security that a hospital system has. And HIPAA is a scalable regulation. You can, so long as you meet the requirement and you can show evidence of that for your organization. BYOD is another piece of the puzzle that comes into play. You have all of these iPads, mobile phones that all of us use for convenience sake. We all do. We don't know what to do without it. If we lose one, we automatically go out and buy another one and replace it. We need to make sure that your organization's policies and procedures address those type of activities, that if a device is lost or you change it, there's a process that you go through in order to make sure that device is provisioned on your network and it doesn't create any security risk for an organization.
Thank you. And that actually touches perfectly on our next topic, which is benefiting from BYOD. And I know you've mentioned some of these items, but we know that BYOD actually has a lot of advantages too. We talk a lot about the risks, but they can create more free space, less clutter, and lower costs, and deliver more services more efficiently. But in terms of in-health and BYOD, how can healthcare organizations benefit from these gains while addressing the risks of BYOD? Are there any other additional comments that you would have around that?
Well, I say the benefits are numerous, and we all know what the benefits are. And I don't think any of us wants to, retard the progress because I think it's been advantageous for us. Just need to make sure that we have that organizations and healthcare customers and their users, you evaluate the need for a BYOD program. You need to evaluate the need for the user. Not everybody in your organization may have a business-related need to be involved in a BYOD program. You need to evaluate that and determine, is it appropriate, is it effective, and if so, implement accordingly. But open BYOD for everybody may not be the best solution. It may be the easiest one because it's flip a switch and so forth and everybody's granted. But in many cases, I would recommend that you have some type of evaluation process in place that determines who is eligible for your BYOD program, what devices. You need to evaluate your devices to ensure that the devices that the employees want to onboard comply with your security protocols.
Yeah, it's all about having the right controls. I mean, certainly there are numerous benefits, right, to mobility in the healthcare field. But from a compliance standpoint and from a security standpoint, it's all about protecting that information. Because nobody wants, to find out that their data was breached off of somebody's, smartphone, right, in a Jimmy John's, right? So it's a matter of just being, putting the due care into it and making sure that you have appropriate controls to make sure, if there's going to be data on the device that it's encrypted, that you have the appropriate controls around authentication and authorization. And let's not forget, to make sure, particularly in your EHR systems, that you have a comprehensive monitoring program in place where you're looking for misuse of patient records.
And that actually ties back to one of the risk assessment activities. That's one of the requirements in a security rule, is to ensure that you have an audit and review process, a user access review process in place so you can help identify, inappropriate use of the information or inappropriate access of the information, whether or not it's a mobile device or whether or not it's a desktop.
Yep, and they'll want to see that that's being, continuously audited.
And that's the biggest, from experience, auditing access and review is probably one of the biggest challenges that a healthcare organization has, because it takes there's the electronic aspect of it, but you also have to have some human intervention as well.
Okay. And next item here is, well, how do you see the board fitting into that? What do you see the board's role is in regards to managing and implementing healthcare cybersecurity and from a program aspect within healthcare organizations?
Keith, I think that's a great question because, you know, many people don't necessarily make a connection between cybersecurity and the board of directors. But from my perspective, you know, the board of directors, you know, is there for strategic purposes, and they're there to help ensure that the organization is managing its risks appropriately. And some of those might be, you know, legal, regulatory, compliance risk, and some of them are operating, you know, or operational risk. And that's really where cybersecurity comes into play. So, you know, when it comes to our annual or whatever the period is, right, where we go through our security risk assessment process, you know, that's going to identify risks. And if we do penetration testing exercise, that's going to identify risks. And it's really about, you know, taking those and interpreting those for executive management and communicating that up the chain so that they can take a cybersecurity risk into account along with all the other risks in the organization and be able to manage them appropriately. Now, certainly I might look at a cybersecurity risk in my job as CISO and say, hey, this is, you know, the most important thing in the world to me. But I certainly understand that when that gets up to a, you know, executive management level, whether it's the audit committee of the board or the board, they may look at that and say, yeah, well, we have many other important risks in the organization, and that risk is number 6, you know, where I might think it's number 1. But that's just part of risk management in general. You know, what I would love to see organizations do more of, and I promote this in pretty much every talk that I do, because I encourage board of directors to put somebody with some cybersecurity expertise on their board to really have some, you know, provide some insight into that sort of operational risk in an organization.
No, I'll echo what Doug just said. That has been one of the recommendations I've made, and we've been fortunate in some of the organizations that I've been a part of, is that we've actually had individuals who have cybersecurity or information technology expertise and knowledge that sits on the board. You want to have somebody, and you want to be able to communicate to the board, you know, why your security program adds value to your organization. And cybersecurity, information security are not revenue generators, but I look at them as that we need to have those programs in place in order to maintain the reputation that we have. Therefore, we maintain the revenue that you're generating, because the reputation means a lot to our organization. And it only takes one security incident to harm your reputation. But having your board understanding of why security is necessary, what's a necessary cost, and how you have to spend the appropriate dollars and resources is a very important piece of board education and awareness. That's not going to come through just an online course that you provide to your board. Make that as part of your board retreat and your board retreat process, so that you can educate your board on regulations that impact their organizations. Identify what resources may be needed from a technical standpoint, from an administrative standpoint, and any other concerns that you have.
Okay, great information. And just to sum all of this up, and I know a lot of this has been touched on in various aspects and from different angles in previous questions too, but overall, how can healthcare organizations advance their security programs? In other words, you know, future-proof them in the most effective manner, and what steps can they take to improve their security posture in general? Like, if you had to sum all of this up, you know, what would be the key elements that you would say that providers and healthcare organizations should pay the most attention to?
So I can kick this off. I spent a lot of my time working with customers on this very point here, and I always say the first thing is it all goes back to assessing, you know, and put yourself in an auditor's position and think like an auditor and to go back to the basics. So, you know, I mentioned before, you know, what your users don't know can hurt you. So do you have a security and compliance program in place for your organization? If so, how well is it implemented? Who is involved? How often do you communicate? You know, it goes back to every single person in your organization should be educated and held responsible for ensuring the safety of data and following proper procedures. But of course, you know, getting there is hard. It can be really hard. And it just goes back to users. And you know, you can have the most secure system, but if your users are untrained and you don't have a documented process, bad things can and will happen. So I always challenge our customers to look at their current compliance and security plan, and if they do have one, it's time to review the effectiveness of it and who the stakeholders are. And don't forget to make a plan and a point person for reviewing the latest compliance and security requirements internally and externally. Create a committee with those stakeholders and make sure that there's clear responsibility and that that plan is communicated and enforced across the organization. That's just step one.
I agree totally with Jessica. My point was that I had 3 words, so I was going to actually 4. It's going to be assess, educate, implement, reassess again. If you do those things, if you follow that path, hopefully you will always be identifying risks, because risks are always going to occur. You resolve one risk today, technology changes, you have some additional risks. You need to re-educate based on those risks, make sure the employees don't get complacent about other activities, implement the necessary controls, and then periodically reassess it again. If we can follow patterns like that, I think it will help us to identify and implement the appropriate security controls that are necessary and ultimately minimize your opportunities for a breach or security incident.
Yeah, we actually have a methodology that we use over here at Dell where it's you know, again, the first step is assess, and then you go into, you make sure that you're always auditing and alerting on those key KPIs. And then the third one would be, you know, remediation. You want to make sure that if something does happen, that you fix it, you correct it, and that it doesn't happen again, and that you put preventative measures in place. And then, of course, on top of all that, you want to make sure that you're continuously managing. And then all of this, of course, will lead to good governance, which leads to good security, which will lead to good compliance.
Yeah, and I mean, I certainly agree with everything that Marty and Jessica have said. And, you know, I think thinking like an auditor absolutely helps. You know, but you do have to ask the question when you're, you know, when you're thinking like an auditor, am I looking for compliance or am I looking for security? Because any of those who are veterans in this field understand that being compliant and being secure can be 2 very different things. And so you want to make sure you're taking a security approach to compliance and not the opposite of taking a compliance approach to security. But I think at a very practical level, you know, you've heard me say it before, it starts with the basics. Education is certainly key, but, you know, it's knowing where your data is, knowing who has access to it, applying encryption wherever it's feasible, right, and really focusing on that risk analysis and remediation. You know, if you can nail those things, you're going to be in pretty good shape from a security perspective, and in pretty good shape when, you know, the regulators show up and want to understand your program.
I'll agree. You just have to, you can't secure what you don't know exists.
Yep. Know your data.
Exactly.
Well, thank you, everyone. This has been an enlightening and lively discussion. I want to move it into the Q&A now. We've gotten several questions. We've got time to address a few of these. And the first one here that I'm seeing is that, you know, we know with the Internet of Things and with the movement toward the future that a lot of the onus will be on vendors to bake security into their products and services. And one of our attendees asked, today's healthcare providers are reliant not just on their own electronic health record vendors, but all EHR vendors, because organizations will all be connected. Are these vendors focusing adequately on risk assessment and security, or do you feel like there's gaps there?
I feel that they are focusing on it more today than they did, you know, 4 or 5 years ago. I can evidence that just based on some of the ER vendors that Dell does business with and some of the security due diligence that they conduct as part of their relationship with us. And when I take a look at the type of information and the audits that they perform on our business units within our healthcare sector that support their EHR systems, such as NextGen and others, they actually are quite detailed in their assessment and in their audits. So we know that they are taking those things into consideration, and they're expecting for us as a business associate utilizing their services to make sure that the appropriate security protocols are in place. Therefore, they assure them that they're in place on their end as well. So I think overall, I think the posture for EHR vendors has improved significantly. Jessica and Doug may have a little bit more detail behind it, some of the personal experiences though, but that's my point.
Mm-hmm. Yeah, I think it's improving, but there's some ways to go.
Yeah, it's a maturity, right? There's still a long ways to go, but I do see progress, and so I am hopeful of the direction that it's going in.
Yeah, and meaningful use actually helps them out because meaningful use requires risk assessments as well, and they need to make sure that their programs help facilitate security, meet security controls, security compliance as well. So I think, you know, the other regulations that are out there as well helps drive that.
Okay. Thanks. And then we have a question that actually touches on an interesting aspect, which is the human aspect of security. You know, we talk about a lot about regulations and controls, but there is that, you know, that training and internal aspect as well. And one of our attendees asked, how do coworker social relationships affect technology deviance? And I'm thinking that means, you know, what impact do, you know, social media, and maybe tying that into phishing attacks and human behavior, and how does that impact security?
You know, this is Doug. I think this goes right back from our perspective in terms of how to address some of that. It goes right back to education. You know, and making sure that people are paying attention to, you know, the emails they're getting from people they may not recognize, or links that they're getting that they may not recognize. And, you know, paying attention to these social media platforms in particular, because, you know, people may be connected on LinkedIn or Facebook to thousands of people, and bear in mind, you're connected to people that in some cases you probably have no knowledge of, right, outside of the fact that you may like the same thing. So just expect the fact that there's going to be, you know, unless you're very diligent about it, there's going to be some risk in your social network that you may not be aware of. And so just be cautious with that.
Yeah, you know, just again, it gets back to some of it is education, like Doug indicated, educating your employees. There have been numerous incidents that I've had to investigate from a HIPAA privacy perspective where an employee posted inappropriate information on their Facebook page, or they took a picture in the background at work of themselves, and here's the whiteboard behind them, or a display board that had patients' names and various other information on it, and they posted on their Facebook page, not for that purpose, but for other purposes, but not recognizing that exposure that they just created, or that unauthorized view of that information. Many times it's not a breach, but it's a security incident that occurs that has to be investigated. And in many of the situations that I've dealt with, the employees were just not aware of it. They didn't think about it. So the more we can get them to think about how social media posting of information impacts their daily lives and how that information related to work can cause a security incident or a breach. And but that's been one of the things that I have had numerous incidents involving with Facebook postings by employees. And that's one of the things that I would strongly encourage individuals to make that a part of the education and awareness. Use that as a real-life example.
Thanks. And actually, we just got another question that kind of ties in with, you know, the board and the governance and some of that human aspect. But what are your thoughts on the implementation of technology review boards and strengthening the security posture of an organization?
So this is Doug. I mean, I think from a security perspective, these are really critical functions that you need to have. You know, I can tell you in our environment, right, we're introducing new technology all the time. And, you know, without a good process to sit down and review those technology items to truly understand from a security perspective what the implications are, you're going to constantly be playing catch up, with risks in the organization, and you're going to get risks out in the organization that, to Marty and I's point earlier, that you're not even aware of. And so I think that the implementation of technology review boards is absolutely critical to maintaining a good security posture. And what I would also add along with that is leveraging your peer networks. Again, kind of back to the Michigan Healthcare Cybersecurity Council, we've got a great peer network in place, right? And not just for technology reviews, but for security program areas, for risk assessments. Use those sounding boards. There's a lot of smart minds out in the field today, and there's no reason to, that a security director or executive needs to think they need to do this on their own.
Just on your technical review boards, try to make sure you integrate your HIPAA or security compliance within those review boards. There's representation there so that you actually not just cover the benefits of technology, but you, as Doug indicated, you can actually assess and identify and point out security concerns that may affect your organization. Sometimes those get missed. They get missed by unintentional as they may be. But I think a good cohesive relationship between, compliance and these review boards, I think is an excellent opportunity for you to grow your security program.
Thanks. Well, we're at the top of the hour now. So I'd like to thank all of our panelists and our attendees for coming in today or showing up on the call. And here's a couple of links if you want to learn more. And again, this material will be available after the slideshow. And would like to thank everyone for attending.